Today we're going to be talking about nosebleeds, and nosebleeds can affect people who are young, people who are old. It really crosses all spectrums of the population. Many people who present with nosebleeds have an inciting factor like trauma or being hit in the nose, but for many people there's not a specific trauma that causes the nosebleeds. And when you get a nosebleed that continues to be recurrent, it can often interfere with your ability to continue doing what you're doing. If you're at school, sometimes the school nurse doesn't like to have to handle this, so they want to send the children home. If you're at work, people don't want to be exposed to your, nosebleeds and so forth at work. So we like to try to determine what's causing the nosebleeds and not only treat the acute nosebleeds, but try to do what we can to prevent the nosebleeds from occurring in the future. Some patients have a history of allergies with chronic runny nose, sneezing, itchy watery eyes. Those things can definitely impact the ability to have a nosebleed. So anything that causes an irritation to the inside of the nose chronically can make it easier to get a nosebleed. So when a patient presents with a nosebleed to our office, the first thing we do, of course, is try to stop the nosebleed that they're currently having. But then we try to do some workup to look into the causes of a nosebleed. It may be getting blood tests to look at some of the bleeding factors and to make sure that there's no evidence of a bleeding abnormality. It may be getting allergy testing. So if we can determine what a patient is allergic to and build their immunity to prevent them to being allergic to those antigens, we can stop the inflammation on the inside of the nose, which can often stop the recurrence of the nosebleed. So those are two simple things that we look for as a reason to control the problem and not just the symptoms. Once we do cauterize a nosebleed, we always give the patient instructions on what things we can do to continue to prevent it to come back in the future, such as moisturizing gels, as we mentioned. If you get an acute nosebleed, one of the simplest things to do is apply pressure to the tip of your nose. And I find when people apply pressure, they'll often hold for a few seconds and then let go. You really have to apply pressure for a good minute, as the bleeding is usually coming from this source right in the very front of the nose. So pressure helps to decrease the nosebleed. Elevation helps. So we have you sit up. We wouldn't want you to lay back or lay down and have that dripping in the back of the throat, either for you to swallow or to have it go in the wrong direction. The other thing that can help with nosebleeds is ice. So applying an ice pack to the top of the nose for about 20 minutes every 2 hours, or eating ice or drinking or eating whole things. So the top of the palate is the floor of the nose. So anything that we can do to apply ice to the inside of the mouth actually affects the floor of the nose as well. So 3 of the basic things that you can do to control a nosebleed when you get it is ice, elevation, applying pressure, and then an over-the-counter topical decongestant like Afrin. Afrin is a decongestant that vasoconstricts, and that can stop the bleeding as well. So those are some simple things that you can do at home until you can get back in to see us so that we can treat the problem more effectively. But it's always nice to know what you can do to control the bleed until you can get into the office. If you do suffer from nosebleeds, try these simple measures first: ice, elevation, compression, Afrin. If you do those things and the nosebleeds continue to recur, let us know how we can help you.